As the province touts investments to improve surgical wait times and expand rural access to surgery, questions remain about what the Alberta government is doing to recruit doctors.
My understanding is that we do have the staff in place. Obviously, there are certain aspects of staffing of the workforce that are more challenging than others, particularly around anesthesia.
Both the province's health ministry and Alberta Health Services say they are working to recruit doctors both in Canada and abroad to practice in the province, as wait times for some surgeries are still outside acceptable zones, particularly in rural Alberta. Alberta budgeting $300 million for the health authority to perform over 300,000 surgical procedures this year. But doctors working in Alberta hospitals tell City News they have concerns around who will perform the surgeries, saying there is a worldwide shortage of anesthetists to contend with.
The work environment right now for anesthetists are a lot of changes happened after COVID. A lot of them retired. A lot of the workforce planning around trying to ensure we had enough to keep up was never really done adequately. And I want to praise the government and say, absolutely, we should be focused on decreasing surgical wait times. But as we had more and more burden, and we have less and less anesthetists to do, and then we spread them around thinner and thinner, so they're working in these community surgical facilities and in the operating rooms. There's just not enough of them to go around.
The province adding that over 60,000 of those surgeries will be performed at private charter clinics, which do receive provincial money for surgeries contracted out to them.
We're able to utilize the chartered surgical facilities. They're doing approximately 60,000 surgeries a year. They alleviate the stress on our hospitals so that they can do the more complex surgeries. So it's everything. But again, we're wanting to make sure that they're done within clinically approved timelines.
Alberta's opposition NDP health critic telling media they fear contracting out more surgeries to chartered facilities is a path towards private health care.
We have capacity within our public system to be increasing our surgical capacity. And so when we have that capacity, we should be doing it in the public system.
Reporting from Edmonton, Darcy Ropchan, City News.